John Torres here on my daily doc, where once or twice a week I go over coronavirus headlines, health headlines, and hopefully get you some information you can use to help you, your family, your loved ones, and your community not just get through this pandemic sooner rather than later and as healthy as possible, but just live an overall healthier life. And the main reason I want to do this is because often the headlines can be a bit confusing. It's a sense or two, but once you start getting into the story, it can make sense. And so that's what I want to do, try and make sense for you of what that story means, particularly what it means for you and why it's something that you should listen to, you should focus on. And then at the end of this, I answer viewer questions. So if you have questions, please send them our way. I try to get to as many of those as I can. And they're usually very good questions, and hopefully I can get you some very good answers for those. But let me start off with the numbers of what's going on right now. And if you look at what's going on here in the U.S., we've started to plateau. And for the last couple of weeks, we've been stuck kind of in the mid 70,000 cases a day, right around 74, 75,000 cases a day. And that just has not broken down much further. We thought by now we'd start seeing it coming down. And what we're noticing is in different parts of the country, particularly in the western parts of the country and more northwestern areas, or the colder areas is what I'm trying to say, we're seeing more cases happen. I'm here in Colorado. And Colorado is having issues with occupancy in its hospitals for a couple of reasons. One, because COVID cases are going up, but two, also they are saying they are seeing a lot of other cases other than COVID. As a matter of fact, coronavirus cases are the vast minority of cases they have in their hospitals. The majority of them are other ones, either emergency cases or cases of things that people had neglected during the pandemic for a variety of reasons and now has caught up to them and they're being hospitalized to try and take care of that. And so that is overwhelming our hospital systems to a certain extent. They are not overwhelmed yet, but they are getting in that direction. And the concern is if this trend keeps going up, then that could cause a bigger problem. And as you know, and I've talked about this many times, what typically happens is we have 2-week increments. We have cases happening, and then 2 weeks later, hospitalizations follow. And then 2 weeks after that, deaths follow. And so we're in that stage right now. Luckily, deaths have started to calm down a little bit, and we think that's because of the vaccine rates that are happening across the country. Even though they're not quite as high as we'd like them to be, we are around a little under 60% of the whole population vaccinated. They are getting higher. Here in Colorado, it's around 62% of the population vaccinated. And so that's part of what's driving the cases here. The other thing we think might be driving the cases are, number one, the vaccines. People have had them for 6-8 months now, and we know they are wearing off a bit in effectiveness. And I'll talk about that in just a second. But also, number two, that we're moving indoors. The weather's getting colder, which pushes us inside more. Holidays are coming up, so people are doing more shopping. Masks have dropped. We're not seeing masks being used as often as they were in the past. Social distancing isn't being used as often. And of course, when we move indoors, especially in cold weather, that ventilation isn't being used as often. So all that's creating kind of the equation that is leaning more towards more coronavirus cases. And so hopefully those cases will start coming down. But again, for the past couple of weeks, we've been plateauing right at that 74,000 across the country. And hopefully we don't start seeing more cases happen. We don't see a rise. We see that fall in cases starting to happen. Now, the other thing is what's happening around the world. And if you look around the world, interestingly, it's following a similar pattern. If you look in Europe, for example, in Europe, which had a lot of things under control, right now things are starting to climb cases dramatically in some cases in different parts. As a matter of fact, the CDC just put the couple of countries on our red or our stage 4 alert, basically saying these countries are countries you should not go to, category 4 travel restrictions, because of the high coronavirus cases. And the countries they did were Netherlands and Luxembourg. And the reason is because of what's happening in different parts of Europe. And it's interesting how that thing basically pans out over there. And think about Europe as a big United States where there's variety. The countries are like states here. So things are going to happen in different areas that aren't necessarily going to happen in other parts of it. For example, in that kind of northern eastern area of Europe, we're starting to see cases climb up. And the examples I can give you, looking again at per million population, which is what I like to look at, right now, the Netherlands, 609 cases, United Kingdom, 500 cases, and that has come down. If you look at the graphs, the United Kingdom is dropping pretty dramatically. Netherlands is on the rise, 609 cases. I've been following this. A few days ago, it was in the 400 range, then the 500, now it's the 600 range. Luxembourg, 362 cases. That graph is going up as well as Germany's graph. But if you look at some other states, other countries there in Europe, France, they are 108 and they are dropping. Spain, 63, they're kind of hovering right in that area. They kind of go up a little bit and down a little bit. And in Italy, which if you remember, at different stages in the pandemic, we're having a lot of problems. Right now they're around 89%. And so they are kind of flat as well in that area. And what that's showing is that these cases, even though immunization rates are high, and the countries that have a low number of cases tend to have higher immunization rates, they're not as high as we need them to be. Number one. Number two, we're also seeing that, yes, this is a small world and people do travel back and forth. In Europe, they travel pretty much like they do here in the United States, where you can just go state to state without any problems, without any border controls or issues, especially if you're going by train or car. That means that these things will travel from area to area, and that's what we're seeing happening. So again, in those states those countries that tend to be colder, those countries where winter is setting in a little earlier than other parts of the country, we're seeing an upswing in cases. Now what happens is in the colder weather, the virus gets more active, we know that. Number two, people move indoors and don't necessarily mask as often. And number three, these viruses spread more because we tend to cough and sneeze more because we have colds and other type conditions that cause us to do that, which can help the virus spread as well. And so I think the take-home message here is to realize that we're not through the pandemic yet. We still have a ways to go, even though we do have the vaccines. We do have some antiviral medications that are out there that are looking at getting it authorized as well. But at the same time, we still need to be vigilant. The best things we can do personally: wear those masks, social distance, wash your hands, ventilate as best you can, avoid large crowds, especially in areas where coronavirus cases are high. If you happen to be in a state like that, you want to make sure that you avoid those crowds. And hopefully over time here, over the next few months, we'll start seeing those numbers come down. But the concern is what's going to happen over the holiday season, and we'll see as time goes on. So those are the numbers there. But one of the other things I wanted to talk about, only because I find it very interesting, and it's a question I've been getting, is how is this pandemic going to end? How are we going to know this pandemic is over with? And I was actually talking with a doctor, Dr. Buddy Creech, on my Doc to Doc series I did a couple weeks ago, and I asked him that question, and his answer was very interesting. And what he said was, we are going to know when we start looking at these curves and see these curves become divergent. In other words, these curves start differing than what they are right now. And if you look at the curves, cases, hospitalizations, and deaths since the beginning of the pandemic, they have pretty much followed each other. Cases go up, 2 weeks later hospitalizations go up, 2 weeks after that deaths go up. And they have pretty much paralleled each other. If cases go up, hospitalizations do, and then deaths follow suit after that. He said, which I think is very interesting, we're going to know this pandemic is getting towards the end when case numbers still go up, not as dramatically, but they still go up, but they're not followed by hospitalizations, and more significantly, they're not followed by those deaths. And we're starting to see that happen a little bit. Like I mentioned, we're starting to see hospitalizations rise because cases have risen, but we're not seeing deaths rise quite as much, which is fantastic. Now, hopefully we can get those hospitalizations under control. Now, the reason he said cases will still go up, not as dramatically, but they'll still go up, is because this is going to turn into what we call an endemic virus. In other words, even after the pandemic ends, this virus is still going to be with us. We're still going to have cases, but we're going to handle them through vaccinations. We're going to handle them through these other tools we have, possibly even masking and social distancing at different times if there are outbreaks in your areas. Best way to think about this, think about measles. Measles has been something we've been controlling with vaccination since the measles vaccine first came out decades ago. Every now and then there'll be an outbreak in an area that has low vaccination rates, and public health officials will go in there, they'll trace where the outbreak's coming from, isolate those people, quarantine them, get vaccinations for those who aren't vaccinated, and get it back under control. You'll see similar things happen with coronavirus, and so I think that'll happen as time goes on. Now, right now we're looking at booster shots 8 months out. My guess is that's not going to be the norm. We're not going to have to get them every 8 months, possibly every year, more likely every 3 to 5 years, maybe even every 10 years. But we'll have to see what happens as time goes on, especially if these variants keep popping up. So hopefully we can keep those under control. But that's where we are, and that's how we'll know when the pandemic's ending. Again, when we figure out that cases are still going up, not as dramatically, but they're still going up, but they're not followed by hospitalizations, they're not followed by deaths. We're starting to get there. We're starting to see a crack in this virus and how it's reacting to, or how it's acting on us, and hopefully we'll continue to see that. And then the last thing I want to talk about is the vaccine effectiveness. A big study came out. It was 800,000 veterans, United States veterans, and they looked at them from February to October of 2021. Remember, that is when, right in the middle of that, when the Delta variant came out. And so this was affected by the Delta variant. And they actually found out that protection from getting infected at all, even the sniffles, or even getting infected but not knowing it, asymptomatic infections, dropped significantly. Overall, from 88 to 48%. Biggest drop was Johnson & Johnson. Moderna dropped from 89 to 58%, Pfizer from 86 to 43%, and Johnson & Johnson from 86 to 13.1%. Those are huge drops, but that's in any kind of COVID infection. Sniffles, asymptomatic infections, any kind of infection. But what they found out, which I think is equally significant, is deaths didn't really drop that much. After that time period, and remember the Delta variant was here, deaths, protection from the vaccine, 82% protection from the vaccine. If you're older than 75, the Pfizer gave you the most, the Moderna gave you the most protection at around 75%, and Pfizer gave you 70%, the Johnson & Johnson 52%. If you're less than 65, it was the Pfizer that gave you the most protection. That was 84%, Moderna 81%, Johnson & Johnson 73%. So you're seeing these numbers 70% and above, except for the Johnson & Johnson for those 65 and above, but protection from death. Protection from COVID and getting a little bit of sniffles, not quite as much. And so again, food for thought that these vaccines are great still at preventing death and hospitalizations, serious illness. They've been starting to wear off over time, 6 to 8 months of preventing even the sniffles. And so that's where booster shots might come in handy. And so again, certain things to think about. But as time goes on, we're finding out more about the virus and the vaccines and how they react to them. But take heart in the fact that the vaccine is still protecting you from what I call the big three: serious illness, hospitalizations, and deaths. And at the end of the day, at least in my opinion, that's what we really want the vaccine to do. And then the last thing I want to talk about is sleep, because we just had daylight saving time end. We all got to fall back on an hour and get an extra hour sleep over the weekend, but that can still disrupt our circadian rhythm. But it brings up the topic of sleep. And there was actually a study done, which is interesting, and they found the Goldilocks hour of sleep. When's the best time to go to sleep? And what they found was the best time to go to sleep is between 10 and 11 o'clock for your heart health, for cardiovascular health. And this specifically just addressed cardiovascular health. They looked at 88,000 adults. They were around average age of 61. They followed them from 2006 to 2010, so for a 5-year period, continued to follow them. And what they found was that if you went to sleep between 10 and 11 o'clock, that was the best for your cardiovascular health. Your cardiovascular health was impacted. You had a higher risk of cardiovascular events. Think heart attacks and strokes. 12% higher if you went to bed between 11 and midnight. If you went to bed after midnight, 25%. But this is the interesting part. If you went to bed before 10 p.m., 24% increase in cardiovascular events. And so going to bed increased it by 24%. If you're going to bed early, before 10 o'clock, going to bed after 11 o'clock increased it as well, depending on whether it was 11 to noon, or 11 to midnight, which is 12%, or after midnight, which is 25%. That 10 to 11 o'clock seemed very significant, and it's not significant in the fact that it's a specific time period, but it's significant in the fact that that's kind of the way our lives rotate around things, that we tend to wake up early at a specific time. And so if we go to bed later, then we end up getting not enough sleep. If we go to bed earlier, we end up getting too much sleep. And we've recently found out that too much sleep can cause some issues as well. So what does that mean for you? Well, that doesn't mean specifically going to bed 10 to 11, because there's no causation here. We're not saying that that's actually causing these problems. We just found out that people who go to bed at that hour have less risk of cardiovascular events. And so what it mainly means is make sure you get plenty of sleep. And studies are kind of back and forth, but the general rule of thumb is 7 to 9 hours of sleep. 7 to 8 being the best, 7 to 9 hours being good time for sleeping. And so if you have to wake up at a certain time period, let's say you have to wake up at 6 o'clock in the morning, well, that means going to bed at 10 o'clock. That's 8 hours of sleep. You don't really want to go to bed much earlier than that, because you don't really want to get a whole lot more than 8 hours of sleep. 9 hours maximum of sleep. And so that's where the going to bed early can happen. Same thing with going to bed late. You don't want to go to bed too late, because then you're not going to get adequate amount of sleep. And that's when our body regenerates itself. We know our brain does, but it looks like our body does too. And as one researcher put it, it gives our heart time to just relax throughout the night. And we need those hours upon hours of our heart relaxing overnight to keep it as healthy as possible. So remember, try to get to bed as soon as possible as you can, during that 10 to 11 o'clock hour, or get that sufficient amount of sleep. That's going to be very, very important moving forward. So now let me see if you guys have any questions.
When should we begin to see flu this year?
So we're already starting to see flu, and it's happening very sporadically. We don't know what this flu season is going to be like. If you remember last year, it was essentially a non-event. We really saw no flu here in the United States last year, which is fantastic. But we think the reason behind that is because we were all indoors, we were isolated from everybody else, we were wearing masks when we were out and about, And we think that kept the flu at bay. Well, this year, we're not doing that quite as much. Kids are back in school. We know kids are a huge driving factor behind spreading the flu. And so we think that the flu is going to start coming back more. And we've seen some cases here in the U.S. already, so we've already got a jump start versus what happened last year. And so getting your flu shot is going to be important. Number one, to protect you from the flu, but also it keeps you as healthy as possible and protects you from other things, including coronavirus, because your immune system's strong enough to fight it off. And on top of that, if you get the flu, it's going to get very confusing as to what you have without getting tested. And so that could cause some days of anxiety that you don't need in your life right now. So again, getting the flu shot can certainly help out. I've gotten the flu shot. I've gotten the COVID vaccines. I've got my booster. I'm trying to get as healthy as possible to head into the winter here. So hopefully I can keep that at bay.
Can you talk about fluvoxamine as a treatment for COVID, please?
Sure, there's a medicine called fluvoxamine, which has been around for a long period of time. And fluvoxamine is an antidepressant. It's used for depression, but it's also used, it's mainly used for OCD, obsessive compulsive disorder. Been around for a while, been around to the point where it is now a generic medication. In other words, the patent for it has worn off. So it's very inexpensive. According to some sources, it's only $4 for a 10-day course. When I was looking it up, it's more in a $20, $25, $30 range for a full course of this medicine. But the interesting thing behind this medicine, it actually helps suppress the immune system a little bit. And so that can help keep things under control when people are going through COVID recovery. And so what they found out in these studies is it actually had a very good profile at keeping people safe from COVID. And as a matter of fact, they found it to help, again, with the immune system response, to help with other things, and it protected people from dying, it protected people from getting hospitalized with COVID. And so they're looking into that right now to see if that's something that can be used to try and treat COVID. But remember, these are things, we have monoclonal antibodies, we have antivirals, we have medications like this that can go a long ways towards treating us, but prevention is the key, and that's the vaccine. We need all of these tools, preventions, and then the treatments for those breakthroughs in order to treat COVID and get through that and keep people healthy. So not any one of these is in and by itself the answer to everything. Not any one of them is 100% protective or a cure, but together they all work in combination to keep us as healthy as possible. And so that's where we are with the fluvoxamine right now. They're looking into it. It was a study out of Brazil, about 2,000 people in the study, about 1,000 of them got it. And the ones who got it ended up having less problems with hospitalizations and less problems with death. And so it's very promising, but like a lot of studies, need to be looked in a little bit more.
Can we get flu shots at the same time as our COVID shots for our kiddos?
And this is a great question. Combining flu and COVID, how do you do that? You know, in the past, as doctors, this is a few years ago, we would say if you get one shot, wait a couple weeks to get another shot because we want your immune system to rev up, get protection for that one shot, calm down, and then you can get the second shot. Well, we found out that isn't necessarily as important as we thought it was, unless it's a live or like almost live virus, and this is not our vaccine. And these are not live vaccines. These are vaccines that are either inactivated or they're vaccines that use a different technology, like the mRNA in the COVID vaccine cases. So, bottom line is you can get these vaccines any order you want. Ideally, you get them at the same time. You can get them the day before, the day after you get your COVID shot. You can get your flu shot. It doesn't matter how you space them out. The important part is just getting them. The only caveat I tell people is if you do get them both at the same time, get them in separate arms, get them in separate sites if it's the same arm, because otherwise it could be even a whole lot sore in that one area where you get the shot if you get them two shots at the same time. So again, you can get them anytime you want. But thank you. These have been fantastic questions. And again, we talked about the numbers that are out there. They are plateauing here in the U.S. Other parts of the world, they're going up. And so we just need to be extra vigilant and extra cautious with all this. More vaccinations that people get, the higher the rates go, the less this will be a concern. Pandemic, we talked about how that's going to end, and the curve for cases might still go up, but the curve for hospitalizations and deaths won't. And that's how we'll know we're getting towards the end of this. And then sleep, we talked about that Goldilocks hour, 10 to 11 o'clock at night is the time that they found that people who went to bed during that time period had the lowest risk of cardiovascular events. Can't put two and two together and say one causes the other, but it's definitely interesting and it's food for more research and more study later on. The main point there is make sure you get enough sleep. 7 to 8 hours is ideal. 7 to 9 hours is great as well. And so you just want to make sure you get enough sleep. But otherwise, thank you very much. I hope you have a fantastic week. And as always, I hope you stay as healthy and as happy as possible. Thanks.